it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
A Tale of Two Hygienists presents this week's Tip-episode. Mini episodes giving you the tips to be successful, delivered straight from the experts. This week, sponsored in part by GC America.
Hi, I'm Crystal Spring, and this tip-episode is brought to you by our friends at GC America. I am a registered dental hygienist who's been working for over 25 years in clinical, and the last 9 of those years I've been working pretty much in mobile and public health settings. I'm an advocate for people with disabilities, children, the elderly, and more. I'm a founder of Smiles Across Montana, which is a nonprofit organization that brings access to care to schools, nursing facilities, homeless shelters, migrant clinics, and any other area where people are struggling with access to care. We are a team of about 25 dental assistants, dental hygienists, and dentists, bringing much-needed preventative, diagnostic, and now restorative treatments to some of our state's most vulnerable populations. Today, I want to share with you about the medical management of caries and using glass ionomer sealants. I think that a lot of us think that SDF or silver diamine fluoride, Caries repair, enamel regenerating materials, and glass ionomer cements are only for public health. And that a lot of people don't necessarily think that baby teeth can be sealed or need sealants, or that it's impossible to seal baby teeth, let alone a baby's teeth. And I'm here to urge you to change your mind, to look at sealants as one of your biggest tools to prevent cavities in your office and even in some of your youngest patients, to change your mindset and what you believe about sealants and how difficult they can be and how hard it can be to work on really young children, and your part in preventing cavities and surgery for some of our most vulnerable patients. Just last month, the Journal of the American Dental Association recently stated that each year there are between 100,000 to 250,000 instances of dental procedures involving sedation performed on children in the U.S., and that the majority of these young patients fall within the 3 to 5 age group. This prevalence persists despite children being more susceptible to respiratory issues associated with deep sedation and general anesthesia due to age-related differences in their anatomy and physiology. And this September, the Journal of the American Dental Association again published a study showing that 1 in 12 children aged 0 to 6 being treated with deep sedation had an adverse effect. There haven't been enough studies around sedation, in my opinion, and 1 in 12 is just way too many. This is where we have to start thinking seriously about prevention. According to JADA, children represent the subgroup of patients at highest risk and with the lowest error tolerance for deep sedation supported care. So what are we doing to lessen the need for deep sedation? What can you be doing as a hygienist to prevent cavities from getting to the point where a child needs to be sedated? Because let's face it, there is the point where they do need to be sedated. But what if you could do something to help your patients before they got to that point? Let's look at the medical management of caries through the use of silver diamine fluoride, enamel regenerating materials such as Caries repair, and glass ionomer cements. Our program places a lot of SDF and Caries repair and a whole lot of glass ionomer sealants. There are so many studies out there that support the medical management of caries, and we are seeing daily that it works. I began using SDF and glass ionomer out of necessity. I was seeing kids that at every appointment, I would have to watch a cavity grow, and there was nothing that I could do about it. Until 2016, when the ADA published new guidelines for the use of sealants. These new guidelines said that sealants are effective in preventing and arresting pit and fissure cavities. in both primary and permanent molars in children and in adolescents compared to the non-use. So what it's saying is that it is better to seal over a cavity, a non-cavitated cavity, than it is to leave it exposed. So finally, there was something we could do to stop these cavities from growing. According to the CDC, dental sealants prevent 80% of cavities in posterior teeth, where 9 out of 10 cavities occur. About 60% of kids 6 to 11 don't get sealants. And children from low-income homes are 20% less likely to get sealants than children from high-income homes. So why aren't we placing sealants? Is it because they're difficult, that we don't believe that they're going to stick around, that we don't have the time? Well, I have some solutions for you. I want to spend the rest of our time talking about glass ionomer sealants, and I want to specifically talk about Fuji Triage EP from GC America. This is by far one of my favorite products that we use in our clinic. Glass ionomers are hydrophilic, so you don't need to dry or isolate the area. You can literally do Fuji Triage or Equiforte sealants on almost anyone. I do try not to place in a swimming pool of saliva, but the days of painfully trying to isolate and keep the surface completely dry are done. So glass ionomers also provide rechargeable fluoride release for up to 24 months, and they adhere to both dentin and enamel through a chemical process, so they're going to stick around. They have a semi-permeable membrane, which allows for the easy diffusion of calcium and phosphide ions and fluoride from the saliva into your tooth. And so this helps to achieve faster, more complete mineralization and maturation of the enamel surface. And it does all this while keeping bacteria out. Unfortunately, in our program and many programs like ours throughout the country, we see kids with large holes or cavitations in their teeth all the time. We see these same holes in stainless steel crowns. There will be kids that are in pain and in the nurse's office after eating breakfast and again after lunch. These holes are food traps, and if left alone, can only get worse. So what if there was something that you could do to prevent cavities? What if there was something that you could do to stop cavities that had already started? If you haven't used glass ionomer, then you have no idea how happy you're going to be and just how easy glass ionomer is to work with. So it is not technique specific. I'm not saying that anyone can do it, but it's a lot easier than you think. We're using what's called the SMART technique, where we actually use our finger to push the material as deep into the occlusal surface as we possibly can. So it's penetrating much deeper into the occlusal surfaces. And even more exciting than that is glass ionomer sealants are really easy and quick to apply. You have about a minute to a minute and a half working time to get all the sealants done. And I think you'll be really, really impressed with how quickly it goes. In our program, we really make sure that we go back and remove any excess cement and floss between their teeth, because you can actually seal an area closed if you're not flossing. So I do really urge you to go back and do that. With our older patients, we always use a conditioner first, but with babies, a lot of time, we've had to make adjustments. And we aren't always able to use a conditioner. We do try to use it on all of our older kids again, but with babies, sometimes we are just going to get in there enough to clean the surface off and then apply the sealant. When we're talking to parents about sealing their baby's teeth, so not just their baby teeth, but their actual baby's teeth, parents are really, really open to using glass ionomers. They see how easy it is, and they don't want to have surgery for their child if it's not necessary either. So I just really hope that you'll take a look at Glass Ionomers and SDF, and that you'll consider the medical management of caries.
A tale of two hygienists.